Hello, I'm Dr. Mariana Losekann. I graduated at the Federal University of Health Sciences of Porto Alegre in 2014. I'm at the second year of family medicine residency at Clínicas Hospital in Porto Alegre, and I've been Jiu-Jitsu Clears student for 4 years. It helped me a lot with medical English and to have a good score on the TOEFL test. In 2014, I went to Canada for a med school elective, and I had no difficulties to communicate with the medical staff, the nurses, and the patients. I also was well prepared to present a clinical case in a grand round session, and now I have returned to keep up with my English. Today, I'd like to present a case report. A 40-year-old Caucasian man fell from a second-story roof. He sustained a small right temporal epidural hematoma, a non-displaced right temporal scalp fracture, and a zygomatic arch fracture. His neurological examination was normal. A tetanus toxoid, reduced diphtheria toxoid, and acellular pertussis vaccine was administered. He was managed conservatively and discharged home 1 week later. A few days after his discharge, our patient experienced weakness and numbness in his legs, which progressed to involve his arms. 3 weeks after his initial fall, he was readmitted to our hospital with severe weakness. His muscle strength was 2 out of 5 in his lower extremities and 3 out of 5 in his upper extremities. His deep tenor reflexes were absent at his ankles and knees and were diminished in his upper extremities. There was bilateral peripheral facial paresis, bulbar weakness, and impaired gag reflex. He had diminished touch and pinprick sensation in a stocking glove distribution. His vital capacity was reduced to 1.4 liters. MRI of his brain and spinal cord were unremarkable. A lumbar puncture revealed a cerebrospinal fluid protein of 790 mg per deciliter in 1 white blood cell. Nerve conduction studies revealed prolongation of the upper and lower motor action potential latencies, reduced motor conduction velocities, and reduced amplitude. Median and ulnar nerve sensory action potentials were absent. Our patient was treated with intravenous immunoglobulin and his muscle strength improved. 3 months later, he continued to have tingling in his hands and feet and used the walker intermittently. So, in your opinion, what is the diagnostic hypothesis?